Hello, everyone, and welcome again to the Holon IQ 2022 Global Impact Summit. My name is Vernon Baxter. I'm the VP of Health at Holon IQ. And as part of our Africa Summit, I'm delighted to be joined by Jay Chikezie, founder and CEO of Tremendoc. Jay, welcome.
Great. Thank you, Vernon. Nice to be here. Looking forward to it.
Thank you, Jay. And so in terms of our discussion today, we're going to focus on a few things. We're going to hear the story about Jay's business, Tremendoc, and his experience in the African healthcare market. And then we're going to talk a bit more about some of the challenges and the opportunities facing healthcare firms and governments and systems across this kind of market. Then we're going to talk a bit more about the future path and development for healthcare in Africa. But Jay, maybe if we could start with helping our audience understand a bit more about Tremendoc's history and your own personal history and how it led to you creating and founding this business.
Oh, great. First of all, Tremendoc is a telemedicine platform, is the leading telemedicine company in Nigeria. It was founded by me in 2017. Before that, my first technology company was founded in 2015 called NairaBox. NairaBox is a lifestyle solutions company where we've been able to aggregate cinemas across Nigeria where we sell their tickets digitally through NairaBox, and also are the #1 ticketing platform for the major concerts in the country. My history, in school I started with medicine, studying medicine to become a doctor. That was my dream. But I failed out my first year in med school. I failed out my first year in med school, and I was quite disappointed because my parents really wanted me to be a doctor, and I actually wanted to be a doctor. I felt I had a lot to offer in that space. But when that happened, I eventually graduated with a microbiology degree. And I actually wanted to do something in the medical space. But at that point, I felt there was nothing I could do because I wasn't a doctor. And eventually, I got into artist management to manage musical artists in Nigeria, which is like far away from what I studied. And I enjoyed it
quite
really.
Different from healthcare.
Very, very different. It just took me to another part. And I enjoyed it. I liked the structure we were building. And this was the early years before Afrobeats became what it is today. There was no structure. And I joined a company at that time that was building distribution channels digitally for the music and the movie industry in Nigeria. It was first of its kind. This was in 2011. And that's when I got interested in technology, when I saw what technology could do, for different sectors. I was still thinking about the musical or the music industry, the entertainment industry, till I met my co-founder, who we founded NairaBox together. He built the digital platform in 2011. And then I could see through his hands and what he was able to create, how we could use technology in different sectors. As I said, in 2015, we eventually started NairaBox. And after 2 years, NairaBox gained a lot of traction in Nigeria. And then my first son, got diagnosed with enlarged adenoids. And that caused him to always have a cold, like runny nose every day. And it forced his mom and I to always call a doctor because we were always scared because he had stuffy nose at night. He couldn't breathe properly. He eventually had surgery a year later to take it out. But during that period, we could call a doctor like every day because it was like 10 p.m. at night, 1 a.m. at night. We would get scared because we could see that our little baby couldn't breathe. And we had to call doctors, or we would drive at 2 a.m. in the morning to the hospital to get him treated. But one thing I found was we knew what to do as young parents, but because we were because of the frequency at which we were calling doctors, we knew what to do at the time. But because we were young parents, we told ourselves, not today, we're not going to do this ourselves today. We still need to hear from a professional.
Yeah.
But because there was no platform to do that, and that's when it hit me. I said, I was fortunate enough because I started studying medicine. I have a lot of doctors who are friends who eventually graduated as doctors. So I had access to call these doctors, you know, when there was an issue. And most times I didn't have to drive to the hospital. But what hit me was that there were over 200 million Nigerians who do not have the kind of access that I do to call doctors. Then why don't I share my contact? And that's how it started. I was like, okay, there are people who probably have this problem, who would need to call doctors at odd hours. Why don't I share my network of doctors on an app, and then they could, you know, have access to these people and pay for it? And that's how the vision of Tremendoc started. In 2017, I eventually was able to raise some angel fund where I launched the platform, but the technology wasn't great as well. And in 2018, I shut down the app, but still kept it running through the website, looking for money to try and develop a proper mobile application. And sometime in 2018, I got funding to redevelop the app, which I did. And then the business model, I was able to come up with the right business model during that time. And then 2019, we launched. It was difficult selling the product to people at the time. And then COVID hit in 2020. Yeah.
So,
COVID
so
hit.
Jay,
Yeah, go ahead.
Before we talk about how COVID changed everything, I'd be really interested to hear your views on what the appetite and understanding or the enthusiasm for telehealth was like pre-pandemic. So when you were there 2017, 2018, 2019, selling this vision for how care can be delivered and services can be conducted remotely, what sort of conversations did you have? What sort of attitudes did you encounter? Because I'm guessing that you know, minds were changed pretty quickly from March 2020 forward. But what was it like prior to the pandemic?
That's a very good question. It looked like we were mad, literally speaking. They thought we didn't know what we were saying. When I thought about the idea, I actually thought it was novel. I thought I was the first person thinking about it, you know, and that's how I felt. I felt, God, this is very innovative, and I don't think anybody's doing it anywhere in the world. But while I was doing my research, I found out that there were other platforms. There was Doctor on Demand at the time. There were some other platforms who had started doing it. But then when we launched the service, I was so convinced that people would see that this was, maybe because I had a personal experience, I was so convinced that it was a no-brainer. It was going to be an instant hit, but I was mistaken. People did not understand it. They felt they were used to going into hospitals and getting doctors to examine them physically. And what I was saying didn't make any sense. Even doctors would say to me, it's not possible. How can we make a proper diagnosis without properly, you know, vetting the patient? You know, we have ways of vetting the patient. We check their tonsils, we check this, we check that, we check this. How are you going to do that? You know, and what I was saying to them, and this is something I usually say, especially to doctors, while I was selling it to them, I said, how many times since you became a doctor have you had your relative or your friend, you know, call you up on the phone and tell you, I feel this sort of way? And then you ask questions and eventually you prescribe drugs to that person and then the person gets well. How many times has that happened? I was speaking to a very old gynecologist who asked me the same question, and I asked her. And coincidentally, she is the first lady of a state in Nigeria. And when I asked her this question, she looked at me and she said, Jay, if I was receiving money, if I was getting paid for every time people called me on the phone since I became a doctor, I should have been a billionaire in dollars today. Right. So I said, you see, You doctors have been practicing telemedicine, but just because I'm coming with an app and you think it's a special technology, it's not. I am just connecting you to that brother who calls you on the phone, who is not your brother, connecting you to an uncle who you didn't know you had, who is in another state. I'm connecting you to an auntie in another state. And so with that, they kind of understand it. I'm like, I'm not doing anything special. I'm just giving you relatives that you didn't have. That's all.
Yeah.
Because you've been practicing telemedicine since you became a professional. But because it wasn't termed that, you think telemedicine is a special thing. So I think another thing, because Tremendo pioneered it, there needed to be a lot of education around it. And we didn't have the right funding to do that. And for me, I felt I needed to do a lot more TV ads, billboards, radio ads, to drive it in, especially to validate the product and say the doctors there are professionals. That was another thing, because patients will be like, how do I know how you vet your doctors? And we needed to find ways to do that. But we didn't have that kind of funding. So what I resorted to doing was trying to get partnerships with big institutions that had good reputation and all that. But it was hard because these companies will tell you, I don't think people will use this service. So that was the kind of treatment we got during just before COVID.
And so obviously COVID has had massive impacts globally, and particularly in terms of how people think about technology and the possibility and practicality of rolling out these systems. It would be great if you could share, firstly, what it was like for Tremendoc and your own experience, but also maybe more broadly, like how the African healthcare experience and system evolved and changed during this really sort of difficult, but in some ways very transformative period.
Yes, for us, it was amazing. I mean, some of my friends and colleagues in the industry, we had a telemedicine company who actually pivoted before COVID and thought there was nothing here. And they got a health insurance license and pivoted into health insurance. The CEO of that company called me and said, Jay, how did you know this was going to happen? Why did you stay? Why did you stay? How did you know? So my friends say, you're an oracle. You knew this was going to happen, because you were very adamant. I think it was because I had a personal experience and I felt this was needed. I just felt like I needed time to sell this product, that if I could sell it, people understood it and people had confidence in the brand, they would use it. That was my conviction. But when COVID happened, so I was doing a lot of the legwork at the time before COVID. I was going to banks. Like I said, since I didn't have the funding, I said I would have to, my strategy was partner with very reputable institutions. So whether it was MasterCard or Visa, or it was the banks, right? Or it was health insurance companies, I went to them and, like I said, they were like, I'm not sure people will use this product. But when COVID hit, immediately countries started shutting down. I started getting calls from these banks and saying, now we need you. We need you right now. So we had strong partnerships with like 5 financial institutions. We're a telemedicine partner for about 10 health insurance companies now in Nigeria, because they didn't know how to feed or to provide the services they had to their customers. I mean, the health insurance companies, because people couldn't go to hospitals anymore, but they had people who had premium for the year. But how is this going to work? How are they going to pay the benefits? Because they were scared that by the next year, people are not going to pay their premium because they felt they've lost their money. And they reached out to us and said, okay, come work with us and then provide this. It was amazing. We're doing about 2,000 to 3,000 consultations daily at the time. It was just amazing. We went from having 1 consultation a day to about 2,000 to 3,000 a day. It was a mad period for us.
And what was that experience like from a kind of technological platform basis? Because obviously, that sort of ramp up in capacity and volume and throughput through your system was were you able to respond to that increase in demand, or did you have to raise money again? How did that sort of play out?
Okay, we didn't have to raise money actually. What we did was we had to improvise. So we're having
Mm.
a lot of consultations. We had doctors, but then what we did, we introduced an offline service, what we like to call an offline service. So we built a customer service unit, and then we started sharing those numbers to our customers. Okay, if you go on the app and doctors are busy, call this number, we'll connect you to a customer service, and then we connect you to a doctor offline. So that's what we were doing. And
Mm.
so we had customer service running round the clock, and people still using the application. So that was what we were able to do at the time to kind of, and then if people were calling and couldn't get through, we had a system that we could see that this person tried to call, but the doctor was busy. Our customer service calls the person back immediately and then connects the person to a doctor. So we had that system that we put together to make sure that everybody was served and everybody had the service.
And in terms of, obviously, the experience for Tremendoc was transformative and very kind of positive one. But in terms of the way that the system coped with the pandemic and obviously the issues in healthcare weren't just COVID, and there are obviously historic issues, and I'm sure there'll be future ones too. But in terms of the broader context of African healthcare, now that you're embedded in it with Tremendoc, maybe you could share some views on what the experience of that period through from 2020 really through till today has been like.
I think it's great. I think that the government as well isn't really looking at telemedicine as a force yet. I think everybody looked at it like, okay, it was because of the pandemic. So now it's eased up a little bit. It's almost like regular programming. But then what is happening is there are other arms of digital health springing up, like drug delivery and sample pickup for laboratory investigations. And what Tremendoc is trying to do is also consolidate these different arms into us so that we provide a full 360 service. So basically, our patients are able to consult with the doctor. Doctor makes a prescription. They pay for the prescription, or if it's a health insurance company paying for it, the prescription gets delivered to them. Or it's a situation where there is a laboratory investigation meant to be done, and then we send somebody to their location. They get the samples from them, and then take that sample to the laboratory or to the lab, and then the investigation is done, and the results are sent to them and the doctor. The doctor schedules an appointment with the patient, and test results are interpreted to the patient. And if there's supposed to be a prescription, the prescription is delivered to them as well. So you can sit down in one spot, get this full 360 service. But like I said, we need to grow to a point where it's a force. I've been at conferences, and had meetings with the Ministry of Health, making them understand how important it is, especially in Africa, where we have low infrastructure when it comes to healthcare, how technology can solve this. Because we sit down and we say we're waiting for the government. There's a lot of things in Nigeria today. We understand how the budget each day is depleted because we're borrowing money and all that. And if we think that the healthcare budget will be increased, that might not happen. So for us, is take what we have through technology, which is way cheaper, and use that to fill up some of the holes and not all the holes that the lack of infrastructure has left. So, and that's how significant technology can be. But I think what it is that we haven't really created a huge dent yet. Tremendoc has done about over 500,000 consultations, but it's still not enough dent for the government to see that, okay, this is a force. What we're also trying to do is work with hospitals to also have a digital arm where, even though you don't have the technology, you can partner with a company like Tremendoc that provides this digital arm for you. But at the same time, because they are used to their traditional way of getting patients walk in, that's where they make most of their money. They are not really enforcing that digital part. During COVID, we partnered with the Lagos state government to get all 21 hospitals on Tremendoc. So you can still meet your doctors through the app while you're at home instead of coming to the hospital and spreading COVID. But the doctors and the way the system is, they were reluctant in pushing it. They were always looking for faults, always looking for, so I think there's a general education that needs to be done from a systemic point, whether it's the regulators or whether it's the government officials themselves, to the doctors, right? To understand how important this is, and this can be an extension of what you do every day physically in your hospital. And I guess it's not just Nigeria. I guess in the UK as well, there's still problems with doctors, meeting up appointments digitally. Physically, they remember their appointments in the hospitals, but when it comes to meeting digitally with their patients, with my research here, because we're setting up our HQ here, and I'm finding that one of the biggest issues is doctors not showing up during appointments digitally. So I think it's a general thing. There needs to be some sort of education around how important this is, and it's an extension to the physical thing that you're used to.
And Jay, if we were to think about the mid to long term in terms of the sectors and the areas and the geographies that you work in, I mean, you've seen an extraordinary kind of growth in uptake of the platform during the last sort of 3 years, 2.5 years. If you were to look at the next sort of 20 years across Africa and across healthcare, and think about the potential for some of this technology and these platforms and some of the things that we've been discussing, where do you think the healthcare sector in Africa could get to over that kind of period of time? And how optimistic do you feel versus some of the challenges that are so well documented?
I think I always say to people that healthcare is a gold mine, especially in Africa. I think that the lack of infrastructure has created a huge opportunity for digital platforms, and there's still opportunity for other things to happen. I think in Africa today, out of pocket for healthcare, payment of healthcare is still about 90% from the population. So we don't really have government or health insurance covering a lot of people. So basically, there's a huge opportunity. But now the out of pocket, where does it go to? You have a huge population going on Google or walking into pharmacies directly and prescribing drugs for themselves, right? Instead of walking to the hospital. So we have people having misplaced payments for their healthcare, right? You see a patient who feels a bit sick goes on Google and researches or Googles or searches for his symptoms, and then you see possible illnesses and possible treatments, and possible just different people putting up articles, and then they take one that they think works for them, and they walk to the nearest pharmacy to buy the drugs. That's basically how some of it works. Or sometimes they call their moms and they'd be like, "Mommy, I'm feeling this way. What do you think?" She's not a medical doctor, nothing. "Oh yeah, when I had malaria, I took this. Okay, you go get this, take this and this and this." She's now become the official doctor in the house, and that's basically how it works most times in Africa. So there's an opportunity. And that's why I keep saying education. There has to be, it's not so much of the culture. I don't think so. I think Africans are very pro technology. If you look at the fintech space, you see how fintech is doing way better in Africa than other parts of the world. They are very pro technology. I just feel that there hasn't been that education yet, and when that happens, it's a gold mine. Because telemedicine, for instance, is quite cheap compared to whatever you get, in your hospitals. They would rather do that than go on Google if they know they're speaking to a professional doctor, and whatever it tells them is secure, it's better for their health. So there's a huge opportunity there, and I think that technology can actually improve. You would have technology companies like us, for instance, thinking about, the more revenue we make, with the more we enhance even the physical hospitals and do our own bit to make sure that people get the right care, whether it's improving primary healthcare centers or improving hospitals. I think that, and this is what I'm saying about the government, trying as much as possible to enhance that digital space, because
Yeah.
we kind of have the formula to get every, I mean, Tremendoc, for instance, we have patients in different parts of Nigeria. Not one single hospital can boast of that, because you could see it's just one physical space. You don't even have the kind of funding to build multiple hospitals. If we did that, then the infrastructure would be
Yeah.
lacking.
They're tied to that physical location.
Exactly. But when you have a technology that is just one mobile application having 1 million customers across Nigeria or 10 million customers across Africa, right? And those are their patients to the doctors there. It's a no-brainer. This would actually make that improve the healthcare system and become a gold mine, as I say.
Well, Jay, that's us at the end of our allotted time. So I just want to say a big thank you from me and also everyone who's tuning in to the Global Impact Summit in terms of the insight and the experience that you've had with the business. And I'm very excited to see where it goes next for you. And
Thank you.
just want to say thank you once again for participating.
Thank you for having me. Thank you.